There are two specific entry points we use in the two-point eyelift technique. The first entry point is somewhere here, and in order to establish the exact location of the entry point, you look at the orientation of the tear trough deformity. The extension of the tear trough deformity is the mid-cheek groove. So the first entry point is where the mid-cheek groove is, and the distance of that particular entry point is measured according to the length of the cannula you use. As mentioned before, the length of the cannula we use is 50 millimeter. So at the bottom of the mid-cheek groove and 50 millimeter away from the medial canthus is where you will have your first entry point. And that particular entry point focuses on rejuvenating not just the tear trough deformity, but the deformity of that forms the mid-cheek groove as well. The second entry point is decided based on palpation of the infraorbital floor or the bottommost part of the orbital rim, and because you're using a 50 millimeter cannula, it is 50 millimeter roughly from the medial canthus, so it is roughly about there. This particular entry point focuses on rejuvenating the palpebral malar groove. And going back to this, your first entry point, you can pass your instrument and rejuvenate the lateral part of the palpebral malar groove as well. So essentially, utilizing two specific entry points, you are able to soften the appearance of the tear trough deformity as well as the palpebral malar groove. And with this particular entry point, it helps you rejuvenate the appearance of the mid-cheek groove as well. However, with the use of this entry point, you can use a different type of filler and raise the lid cheek junction, which is part of the aging process as well, and give your patients a more rejuvenated appearance.